Hi, I'm Erica McClarity, and welcome to another edition of IBEW Our Power Good Newscasts. Providing electrical services in a medical setting can be complex and demanding. And for IBEW Electricians, that challenge was intensified as they worked to help meet Joseph Brant Hospital's urgent need for expansion during the pandemic. I'm talking with IBEW Local 105 Business Manager Lorne Newick in Ontario, Canada. Hi Lorne, how are you?
Hi Erica, I'm good, thank you.
How's it going over there in Ontario?
Everything's good. We're trying to adjust to a different style of life, trying to stay safe.
And your local's still working, right?
So the latest project we took on there was with our contractor, the Plan Group. It was Joseph Brant Hospital. It's located in Burlington, Ontario. It was a new unit that was being constructed. It's a temporary facility being constructed just strictly for pandemic patients. They put an 87-bed unit in. It was complete with, had to be a new service put into the structure itself, a new electrical service, independent from the hospital service. It was actually brought in from the street. Then there was all the distribution that went along with that, powering up the 87 headboards that were there, the nurse stations, washroom facilities, corridor, hallway lighting, and also there was fire alarm, all the network cabling and data as well. We installed in the new structure.
How long did it take from start to finish?
It was about 10 days altogether.
Wow.
But our members, they worked around the clock. There was 2 12-hour shifts, and we had 24-hour coverage. And our members, they really, they did a great job in showing up and getting the work done.
What would you say is the most challenging thing that you kind of heard back from your guys about and gals about what it's like to build one of these temporary facilities?
I think coordination of the trades was probably one of the biggest challenges that they had. Trying to, exercise the protocols for physical distancing was very challenging because everybody was on a very tight schedule to get their portion of the work done. So you had to really work together, not just as a trade, but as a part of the whole construction, and give other people space when they needed it, and then when you were able to gain space, then you went in and did what you had to do.
I know you guys are doing a lot of work on the hospital, but you're also donating your efforts. Is that correct?
We donated $15,000 in man hours just to the Joseph Brant Hospital Foundation for a couple of reasons. Number one is we have a good partnership, community partnership with the foundation. We've been a major sponsor of their events for about the last 5 or 6 years. This year was a little bit more than in past years, but it was a good opportunity for us, I thought, to give back to the foundation, to give back to the community, especially in a time when they really, really needed the help, both to get the job done and also financially.
Do you feel proud? Is your local very proud to be helping in the midst of all of this?
Definitely. That was one thing I did see when I went over one afternoon. They felt very proud that they were able to be a part of it. There's good news out of IBEW Local 105.
Perfect. Bye, Lorne. We know there are more areas where IBEW members are doing their part. So when you post your photos and videos on social media, tag IBEW Our Power in the post, and hopefully we'll get to feature your local in the next edition. For IBEW Our Power, I'm Erica McClarity. See you next time.